However, the situation is truly, from the standpoint of concerning, legitimate in every way. The biggest problem that all of us are concerned about nationwide is one thing and one thing alone, and that is just simply this, is if this thing were to turn really ugly, are our hospitals able to be able to handle a surge of numbers of people that could possibly happen? God forbid that would happen anywhere. We're blessed in West Virginia with our mountains and our population spread out and those kind of things, and we know that the most positive things we can do to combat this potential monster is that we wash our hands, keep our hands away from our face as much as we possibly can, absolutely avoid big crowds, and just do the things that we would do every day if we were adding the component to watch what we're doing and just be smart and vigilant about what we do. Now, yesterday, somebody had to make a really tough decision about the state tournament and travel bans and all that kind of stuff. And I would tell you just this, is really, if you'll watch me and watch me closely, when things get really tough, that's when I'm going to get my quietest. And that's when I'm going to dial in to the very best of every ability that I have. Now, here's going to be another tough decision. What do we do about schools? You know, one of the things I needed to talk to you about yesterday that I thought, well, you know, we're not ready about this yet. And that is just this, is we have a lot of kids in our schools that the school is a safe place. The school is the place where we can really get fed. The school's where I get 2 meals a day and where I learn and where I feel really safe. Now, those institutions, especially within our state, carry with them great responsibilities. And I take those really, really seriously. But I did tell you yesterday just this. If I felt like in my mind that it was probable, absolutely without any question, if it was inevitable, but if it was probable that we were going to get to a situation where we were going to close the schools, I'm closing the schools. Now, again, a tough decision. Tough decision. But the reality is just this. It's why you pay me the big bucks. You know, at the end of the day, you want a governor that'll make tough decisions. Irregardless of the political ramifications, you want a governor to make tough decisions. I'm closing the schools. That's all there is to it. You know, I feel like in my heart that the probability is likely that we will have to close our schools. To me, the risk outweighs the good. And now what we have to do is fall back on Clayton and all the powers to be to say just this. And they're ready to take care of our kids, to take care of our kids that are at risk, to follow up with calls to their homes and everything, to check on them and check on how things are going there, to absolutely still be able to feed our kids. But really and truly, we've got to close the schools because the probability is just too high, and that is a breeding ground. We know that, and they can go right straight back and go to their grandparents or whatever it may be and cause a real life problem. At the end of the day, I said before, with every action there's an equal and opposite reaction, and absolutely there's a downside to this, but it is the right thing in my mind to do. And so I've taken advice from lots and lots of different people, and lots of different people have said, we got to close the schools, and then there's others that said, no, we can keep them open, and we can do this, and we can do that, and everything else. And at the end of the day, what we need to do is achieve all the things that our schools need to do for those kids that have real needs as best we possibly can, and close the schools. And your first question is going to be, how long are we going to close the schools? And my question to that would be, we'll close the schools as long as we have to close the schools. You know, so where we are is just plain simply this. We've got a monster that's looming, but the monster's not here. Every single one of us believe the monster is coming to some degree. Every one of us believes that the monster, we're going to be able to handle the monster in every way. We're going to be able to do that because of the preparedness of these great people, because of our nation and our commitment to doing everything the right way. There's no way that this monster is going to get us. But let's be smart. Let's be smart. Let's go about our lives. Let's don't panic. Let's don't be afraid. Absolutely. There's times in life where you've got to stare down the monster. That's all there is to it. You've just got to look back and say, we're going to be so prepared that we're going to take care of every single person, especially every single person in this state, and we're going to look after them, and we're going to be ready. We don't want to compound the problem. Yesterday was a tough day from the standpoint of closing our school, shutting down the state tournament and doing things like that, but again, right thing to do. So, we've already announced today as far as extracurricular stuff at the schools, but we did not announce that we're shutting the schools down. But now that we've got a whole lot more information and everything else, and like I said, I'm not going to put that on anybody but me, but that's what we're going to do. So, I guess now we can take your questions, and if you've got some questions, yes, sir.
You said yesterday that the situation was fluid. You would make decisions as were warranted as new information became available. What new information did you receive from yesterday to today, or what did you consider that led you to this decision this morning?
Well, believe it or not, I'm in the schools a lot because I coach and I love kids and I'm with them a lot. You know, I was with my ball team yesterday when I left here and everything. And of course, they were really disappointed and really upset about the fact that they had worked for 5 months to get to the state tournament, and then what's happened. And some of the kids were freshmen, and they just couldn't understand. It was really difficult for them to understand. But when you look around and you look at them, and you see that right with them, you know, are grandparents right there. And you look around and you see that Kentucky and Maryland and I don't know if it was Virginia or not, but Kentucky, Maryland, and Ohio have all closed their schools, you know. And you think that in those states there must be a bigger awareness or a bigger worry than what maybe we have here in West Virginia. But the one thing we've got in West Virginia that maybe, just maybe, those states may not have, that is to the magnitude of what we have, is the elderly. You know, we're in an older state, and the elderly is where this monster attacks. And so I just couldn't get by one question that just kept coming and coming and coming and coming. And here's the question. You know, there are real benefits to keeping the schools open. There's real benefits to those kids, and gosh knows, if you know my heart, you know I love all the kids. I love all the kids. And I want to help them in every single way. But when you just think about this one question, and it keeps just coming back and coming back and coming back, and that is just this: what if we awaken to a real live bad situation? What if all of a sudden we awaken to a situation to where we've lost a bunch of our elderly people? How are you going to answer the question? Because then at that point in time we react, boom, and we close the schools. How are you going to answer the question of why did you wait? You know, we're going to have to find a way to take care of the kids that are there.
Can you elaborate on that a little bit? I mean, I think we all know why you are closing the schools, but there are serious concerns about closing the schools, including how are kids going to eat, and you mentioned it being a safe space, there's a lot of uncertainty. Are there plans in place to address those things for those kids?
That's why we've got the weekend to get everything in place to take care of those kids. We are already working on it like crazy and everything, and we're going to try with all in us, and I'll let let Clayton Birch expound on that in just a second, but listen, within every way that we possibly can, we're going to try to take care of those kids. Again, you got to look in my heart and know that in every way we're going to try to take care of those kids. But how do you answer that question?
So do private schools go?
I think that's everything. Yes, sir.
When will they be closing? Will they be closing right now, after school ends today?
After school today.
Mr. Burke, could you elaborate on that question?
Absolutely. So I think we've all taken a page out of Governor Justice's book that we're going to care for children first and foremost. One of the things to think about is we've been preparing for this for weeks. This is not something we decided today to put a plan together. We knew that it would be an issue. We have around 200,000 children in the state that rely on meals. We've already been working with the U.S. Department of Education on waivers of how to do that and serve meals and provide meals. We've also made a commitment to our state through the First Lady and the Governor for communities and schools. We have put a lot of resources in our schools to care for our children. They are poised and ready in this action plan to make sure we're serving those children ongoing through this closure.
Can you give us specifics on that, how that will work?
Absolutely. So there's going to be a variety. Every county has been asked to put together their preparedness plan. I was with all 55 superintendents this morning, as a matter of fact. They're all ready. They knew this day would come. They knew they would have to think about how they're going to feed. They can do that in a variety of ways. They can deliver. They can do pickups. We're going to follow similar to what Kentucky's doing. We'll make sure the basics are met. Then, we do have adults that are ready. We have counties and districts that are ready for distance learning, but more importantly, we have adults that are ready to support the schools. We have increased our counselors, our social workers, our school nurses. We're going to have adults that are going to be there to support families.
And to kind of go on with that, one of the places that kids have access to healthcare the most is school-based health centers. Will those remain open, or are those closing as well?
We'll actually work directly with Secretary Crouch and Dr. Slimp in their offices. They've been a great partner, and they'll actually guide us through that process to make sure of how those resources remain available to families.
General Hoyer, National Guard is delivering meals in other states, in New York specifically. Is there a chance the National Guard will be involved in giving meals if they are needing to be delivered?
Yes, Kenny, it would be no different than what we do during another state emergency. If the requirement is there to deliver to local areas with our, what we call our community assessment teams, that's part of the planning process that we'll continue to work through.
Governor Justice, yesterday you had said that you were recommending events with 250 people plus get canceled. Now that you're closing schools, will you close those events with large groups of people?
I don't know specifically that I have the power to stop an event, that has 250 people in it. I don't know in a private enterprise if the governor has the authority and power to be able to do that. But I would strongly discourage any large gathering, because that's exactly what we're trying to do nationwide to be able to get a grip on this. Now, I want to say something else too. Just think about this just for a second. We're telling people to stay away from large gatherings. And another thought that just surely has been on my mind is a lot of our teachers are elderly, and we're saying, come to the school, you need to come to work, and everything, and we're subjecting them to a tough situation. We need to look after them too. They're really our jewels in every way. They do look after our children, and they educate our children, and they do so much for our kids. And to say, well, we're going to bring you into this arena every day, that's too much too.
Do you have instructions for employers, because this announcement will, inevitably affect working parents who have been on school to have their kids while they're at work?
Yeah. I said this yesterday, and I think you're already seeing this. In fact, I know you are. Our nation and our state is going to have to really step up beyond the call here. I don't know all the intricacies of how that step up means, but in this situation, to where we're basically putting undue hardships on families, or maybe if you're feeling bad and you don't really think you ought to be at work, and we're telling you to stay home, and then you stay home and you lose a day or 5 days pay, and you can't pay for your electric bill and whatever like that. There are so many things that really our nation and our state that we're going to have to try to step up in every way we possibly can to try to backfill those situations.
Governor Justice, you mentioned there's 12 people that have been tested. There's many people out there that are concerned that's not enough and there aren't enough testing available. Can anyone who wants to be tested be tested?
I think Bill Krause needs to answer that, but you're exactly right. 12 people tested. We know it's here. I mean, let's be real. It has to be here. We just haven't found it yet, but it's got to be here.
Yeah, we have followed CDC guidelines from day one. Again, and I've said this a lot, West Virginia's lower risk than most states. 2 days ago, there were 13 states that had no cases. Yesterday, there were 3. I haven't looked at the news much since yesterday, but I think there are still 3 states that have no cases. So what the governor's trying to do is be proactive, and what we're trying to do is keep our citizens safe. We are really, at this point, ahead of this. Now, are we going to have cases? Yes, we will have cases in West Virginia. It would be highly unusual if that virus didn't reach West Virginians at some point. So testing is an issue. It's a huge issue. I said earlier, in the United States, there have only been 11,000 tests run. In South Korea, there were 230,000 tests done with a population 1/6 the size. So we need to get more testing, and we are. That testing is coming. Commercial labs are being approved. I believe 2 commercial labs have been approved. Our hospitals are stepping up. They're going to begin testing next week. So we already have word that hospitals will begin testing. So testing will become wider, more available as time goes on in the next week or so.
Secretary Krause, why do you say we're low risk? Is it because of our location, and why exactly, what factors
Yeah.
at this point make us low risk?
we don't have a lot of international travel. Individuals who come into the country, back into the country, are checked where they come into the United States. And so we have flights into Charleston from Charlotte and Atlanta and other places, but those individuals are tested for the virus if they are from one of those selected areas. So that keeps us a little low risk. We just don't have as much international travel. So one of the reasons that the schools closed after spring break was because students go all over the country, all over the world for spring break, and that's become a ritual. But those individuals the virus back to West Virginia. So that was very prudent on the university's parts to take that decision. And we're all talking. We're all in communication in terms of what are the best steps going forward. So I think the governor's been extremely proactive here in a state that has no cases. We're trying to make sure that we get information out, that people know how to protect themselves. They know, and again, I've said before, this is a virus. We have viruses when we have colds. And if you notice, people who have a cold don't shake hands. People have a cold, stay home. This is a little different because it's much more contagious than a regular cold. And we need individuals to understand, take those actions now. Take those actions now. Do not touch your face, as the governor said. That's the entry point, mouth, nose, eyes. So what we're trying to do is provide information to the public that this is a virus. It's something we can all do something about. We need to protect ourselves, and we need to protect our family.
Secretary Crouch or Dr. Slim, question for either one of you. The CDC has recommended that doctors recommend to patients to be tested, unless it's changed in the last couple of hours, that you just can't go get a test if you need to get a physician recommended. Is that the best way, do you think, to handle this, or if people are so concerned and worried about it, should just anybody be allowed to get a test?
Yeah. You know, this is no different than other tests in the healthcare system. If you go to your doctor, they assess your need, and they order medical activities, medical tests, medical procedures based on need and how that will change your management of things. And so I would see this one as no different. So the recommendations are kind of standard that, that there are criteria around doing this. I think what we recognize and what's really challenging is, and I think we are all frustrated with it, there is just not a public supply of testing ability that we would all love to have. I mean, we would, every one of us would love to say, let's just have everybody get tested that has any kind of symptoms, but that would actually not necessarily use the supplies that we have well.
You talked about hospital capacity. This is something that has been a concern for West Virginia. How do we deal with capacity? Do we have concrete numbers on what the capacity of West Virginia is to actually deal with this if it were to come and be as dramatic as it has been in other places?
It's not a magic question of X number of patients. So there, certainly hospitals are planning around this. They plan for surge. They know their own capacities more internally. But it all depends on what level of disease we see and how severe we see that disease and how our public handles it. So if people that are not needing to have care, that can take care of themselves at home, show up in doctor's offices and ERs, it will decrease our ability to handle this. So that's the importance of people knowing how to handle it at home. If they are able to do that, they're not stressing the healthcare system. That's the importance of employers supporting staff to be able to come to work when they need to, so that we can maximize our ability with that.
I think, to kind of go off of that, I think one of the consequences of the fear surrounding coronavirus is that we've heard a lot about testing. So, oh, I need a test, but then it puts people out in public. So can you address for people, if people are sick, how should the general, and how do people react?
Sure. So, and again, we don't have evidence of anything widespread, anything active here right now. But let's picture when we've got disease spreading. And if someone has symptoms that would be like lower respiratory tract infection symptoms, same things that you're going to have with flu and other things. If you have those symptoms, if you are well enough to stay at home and take care of yourself at home, you will stay home and take care of yourself at home. If you are needing to go to the doctors, then you go to the doctor, just like you would with flu now in the outpatient clinic. If you are so sick that you need to be hospitalized or you have to call EMS, then you would do that. But you use that same judgment that you would use every day on your clinical status.
So
With
it's
that.
not necessary for, you're sick, to get a test.
Correct. You want to use your tests actually are going to be the things that change your management. So for instance, in infection control at the hospital, you want to know the status of that patient. We also know that, when you have more widespread disease, you can make the assumption that it's that and you handle it that way. When you don't have widespread disease, there's no evidence of it. It's not going to change how you're affecting it. So right now, we're testing anybody who's very sick and needing to go to the hospital. We're testing it from that angle with no history of exposure because we know it changes the management there. If I had an ideal world, you'd test them all.
This might be low on the priority list today, but is there any possible thought of a special session that would allow the absentee ballot requirements to be loosened a little bit, to allow unexcused absentee ballot casting, and maybe we can change the number of poll workers at each poll from, say, 5 to 3, in order to mitigate some of the concerns about
Right.
what we're dealing with?
Well, Kenny, I met yesterday with our Secretary of State, Mike Warner, and we went through all the different, what ifs and all that and everything. So we've already been in a whole lot of discussion about that, and all I would say to that is, for today, that's premature, and we'll get to it. We'll just get to it. But I can trust you, we're on top of that too. Let me say this, and I want everybody to get this really clearly. When this really boils down to what makes a decision to close the schools with me, it's one thing. It's the question of if this thing were to turn really ugly, and let's just say that it got bad enough that all of a sudden, in a very short order of time, we lost 150 elderly people. How do you look back and say, was it really okay not to close the schools when this situation could happen? That's the first thing. The second thing you got to weigh out is how are you going to really take care of those kids? And if you've got the network here that's already been working on it like crazy, and they say to the very best of their ability, they can take care of those kids. And then on top of that, you've got to be concerned about just this, is just what I said earlier. You got a lot of teachers in those schools. Why in the world, would you subject the people that we need so badly to teach our kids and do the work that they do? If you subject them to this, why wouldn't it be okay to subject us all to this? And so when you go through those steps, 3 steps, what about our teachers? What about if this thing really turns super ugly, and how are you going to take care of our kids? And you get the answers to this, you close the schools. That's all there is to it.
You closed nursing homes yesterday. Would you consider closing hospitals to keep other people who are at risk?
No, I think that's a decision solely for our medical superstars and not me, because they know much more about that than I. Well, we're working on every single thing you can work on, Brad, as fast, as hard as we can. The senior centers are a real concern.
We actually had a call with senior centers yesterday.
And I am aware, speaking with hospitals, that they're looking at restricting visitation and having a process for that so that that's reduced. So everyone's moving in the same direction here in terms of making sure we protect the public as much as possible.
We can just, the warmer weather's going to help us. If we can just get, all of our people know just this, we got to flatten out the exposure. That's all there is to it. You've got to elongate this situation to where we don't have a big peak that could cause a real problem. I think that's,
I know during the teacher strike, food pantries kind of picked up to work with having students out of school. Is there any coordination with food pantries currently to address the food issues?
Absolutely. General Hoyer might want to add in, but in the preparedness plans, a lot of our districts will actually tie into those community resources as well, so it won't be solely on the schools. Especially beyond the breakfast and lunch, we also have many students who utilize after-school networks for dinners or snacks.
As we talked about earlier, we'll look at this no different than we looked at the response to the 2016 flood, where we're tasked to provide support to communities directly. We'll have the staff in place to go out and provide that support and coordinate through the appropriate agencies to make sure it's delivered.
Is this the closest to the flood of any sort of disaster or disease preparedness that we've had in the state in recent memory?
I think probably so. Each disaster is different, and you got to respond to each one differently, and this is obviously different than a flood where you can see and touch things, but we'll be prepared to provide the support necessary to make sure that people in the state of West Virginia are taken care of.
Superintendent, can you give me more detail about perhaps the override state plan or what you've seen in some of these county plans for how to actually feed these kids? I understand that there was some sort of waiver that was given the other day to provide non-congregate feeding.
That's correct.
And so how are you going to do that? How are you going to serve kids separately, not at nexuses, to make sure that they're safely apart from each other? I mean, you're going to deliver the meals on buses? Like, what's going on?
Yeah, absolutely, Ryan. So some of the delivery mechanisms will be varied. Some districts will utilize buses. They can even utilize the bus stops. Kentucky right now is utilizing a drive-through mechanism where families, when they can actually come and pick up the meals. And then we'll also tap into resources such as General Hoyer said to utilize others that can assist in some of that delivery.
And there are like several laws that could get in the way here. I don't know about the power to waive them. With the action that the governor has announced today, closing all public and private schools in the state, is there going to be a waiver of the 180 days requirement, or are you good on that because the winter was mild and there was a strike? And then also, have you requested from the U.S. Department of Education that standardized testing be canceled?
Those are actually very easy questions. I will tell you that we already know our plan for that, but right now the priority was the health and safety of these children. So I'll be honest, meeting 180 days was not primary of my mind. It's not a conversation I've had with the governor because I was more interested in health and safety. And I'm actually going to applaud the U.S. Department of Education because the very first question that we asked for my staff was, is that going to be considered? And our response from the Deputy Secretary was, you do not worry about assessment and testing during a crisis such as this. Let's worry about the health and safety of our children. We will deal with those things and we'll have to have a plan for those. But at this point in time, our primary concern is the health and safety.
But she hasn't said to you, or no one at the U.S. Department of Education has said to you that standardized testing is off this year?
I'd like to add one thing. People need to look at plans for their parents and their grandparents. We need to have a plan in mind in terms of how you're going to make sure they stay away from crowds. You may want to do their shopping for them. My mother's 89. I'm going to make sure she has food and cat food, and she'll be happy. So we all have to take a look at our family and protecting our family, especially those that are elderly, because that is where this virus really is the worst. And so please, everyone, look at your own situation and develop plans for that situation.
Secretary Crutchfield, I must say that one of the issues with a state like West Virginia is isolation. I mean, we have elderly people who are isolated, and after Meals on Wheels and stuff comes in, I mean, how do people who don't have people, who might have young people who moved out of the state, what do they do?
Yeah, that's a good question. And of course, we have a hotline that we can try to help make arrangements for families, for individuals, elderly individuals who may not have other resources. We do that anyway through Adult Protective Services and through some of our programs. So we're available to get involved in those wherever we can.
The other piece with that is, and we've talked to senior agencies about this, there are ways they can do services in different ways. You don't have to close them. And so it's really about thinking creatively about how do you make sure you deliver meals, how do you connect to people via other mechanisms, how do you continue your services in small groups. So this is where you really need to be thinking about how do we do this creatively. Similarly with families, families with kids at home, and that's an additional stress on families in terms of having to figure out work, et cetera. So I think this is an opportunity for our social service organizations and our communities and our volunteers and our faith-based groups to really support young families so that it doesn't make it a more stressful situation for them.
Let me bring it to a close, okay? And again, I have to say this because I see in the background a lot of our cabinet secretaries and people that I'm with an awful lot. Yesterday, we had all the cabinet secretaries and everybody came together and I don't have the opportunity, or really, I guess I have the opportunity, but I don't say this enough. And I don't say this braggadociously, but when I walked in the door to where we are today in the state of West Virginia, those people have done, if you want to cut me out of the situation, those people have done an amazing job. And our state is sound and moving in the right direction, and lots of goodness goes towards these great people and all those people that were in my office. I want to just thank them again for all the great work they do. And the other thing I want to tell you is just this, is I know I'm a little different because I'm all over Kingdom Come and I'm not just hanging out here and having a party, but I'm everywhere. And one of the things that I'm telling you, just going to tell you right now that I am really proud of is we had a situation where we had a hospital in the 7th largest city in the state that's closing, and that's in Fairmont. And right as soon as I leave here, I'm going right up that mountain and get on a plane to fly up there to announce something that is absolutely unbelievable from where we started. And to just tell it like it is, I had to sit on a lot of people for us to be able to get to where we've gotten to. But what we're going to announce up there is, there's going to be a few little bumps and bruises along the way, but we're going to announce the real deal hospital that's going to be on the way to come, and a resolution to that is going to be a real long-term wonderful fix for our 7th largest city in our state, and absolutely, I am really proud of that. So I'm not going to tell you more than that, but I'm going to tell you that I'm on the way to Fairmont. And let's keep working, let's keep living our lives, and let's keep doing absolutely anything and everything we can to help one another. And the last thing I would tell you is just this. The question, I think, just came from this young lady over here, is how are we going to take care? And I would just say just this. West Virginians are the best and the greatest of all. If we have a need and we have someone that's across the street from you and they need a helping hand or they need a hot meal, we have the whole network set up. And if we've got someone that we're falling through the cracks, for God's sakes a living, let's, as West Virginia, rally around and try to help every single one of our neighbors in every way, shape, form, or fashion. And we're going to beat this dadgum thing. I'll promise you that. Thank y'all.